Hi friends, I'm so sorry there was some technical error back then. So fine, we'll start all over again. So today we are going to discuss about a very common disease that is found in children, that is tonsillitis. Tonsillitis, when we say count about 1 in say 20 children are known to suffer from tonsillitis, wherein there is infection of a gland called tonsils. Tonsils are located over here at the base of your throat, wherein when they get infected they produce inflammation, which is known as tonsillitis. So before we start with the details of it, like I was talking earlier also, like tonsils have a very crucial role to play in your body. It is basically a part of your immune system. Yes, like tonsils, there are another glands called adenoids, which are located at the base of your nose. So both adenoids and tonsils have a role in protecting you from bacteria and viruses invading your body and trying to make produce illness in you. So basically they are your fighting soldiers, so they help you from enemies. So when I hear doctors suggesting surgeries for little kids suffering from tonsillitis, I feel bad for the parents because they feel that removing the tonsils are solution to the recurring infection of the tonsils. But on the contrary, that is not the case. You are actually removing soldiers from your body's defense mechanism, and you are welcoming the virus and bacteria attacking and invading your body further. So that is actually, you are welcoming the viruses, you're welcoming illnesses by removing the tonsils. So today in this live session, we are going to discuss as to how we can protect our tonsils, how we can protect our immune system, and how surgery can be prevented with safe, sweet medicines in homeopathy. So talking about tonsillitis, like why does a person or why does a child have tonsillitis? We have to understand that first. So when a virus or a bacteria tries to enter your body, maybe into the stomach or into the lungs, they have to first face the tonsils. So tonsils are the first line of defense which the body has to prevent them from entering further. So if your tonsils are intact, if your tonsils are working fine, these virus will not dare to enter the system, enter the blood circulation. So tonsils in that way play a very crucial role. What happens is, at times the virus or the bacteria are so strong that the tonsils are not able to cope up or not able to fight off those virus and bacteria. So it starts producing warning signs, it starts producing alarm in terms of inflammation. It starts showing redness, it starts showing swelling, it produces pain, so that you realize that there is something happening into the body. There's some foreign body trying to affect you, trying to make you sick, and you then take precautionary measures, or you then take necessary steps to take care of that infection. So in a way, tonsillitis is a good sign. It alarms you that something is going wrong with the body. Now if the solution to this is removing your tonsils, well, you are removing that alarm for that matter, and you are allowing then the virus and bacteria to enter inside your body and give rise to other severe problems. So my suggestion over here is, firstly, say no to tonsillectomy, that is, say no to removal of tonsils, and say yes to homeopathy, which is capable of saving your tonsils. So before we proceed ahead with all the other details of tonsillitis, let's take up some questions. Okay, Aman is saying hi. Hi, Aman. Okay, he has a question also. Can having ice cream make my tonsils bad? Well, Aman, yes, tonsils are your defense mechanism, and it is known to get affected by viruses, bacteria, and there is also a component called allergic component. So your tonsils, if they are allergic, if they are sensitive to certain things like ice creams or cold drinks or change of weather, these things can trigger, and these things can make your tonsils infected or swollen. So if you are sensitive, yes, but then your body is, if your immune system is good enough, it is known to fight off with these allergens also. Christy is asking, every time I get a cold, my throat starts aching. Okay, is it because of infections in tonsils? Christy, yes, this may be tonsils or this may be pharyngitis, like your respiratory system connecting tube, if that is also inflamed, or if your tonsils are swollen, you may have pain in throat. Like throat pain is a very common symptom of tonsillitis. If you open your mouth slightly widely, you can see your tonsils over here. If they are infected, they become enlarged in size, they become red, and that causes pain when you talk, when you swallow. This is one of the signs of tonsillitis. If you feel there is throat pain without this swelling, it may be pharyngitis. Nupur is saying, hello doctor. Hello Nupur. What can I do to improve my immune system? Okay, this is very broad spectrum question that Nupur is asking, but yes, Nupur, we can do certain things which help our immune system. As far as the topic is concerned, not removing your tonsils can boost your immunity. When it comes to other things, lifestyle management, diet, having a stress-free life, exercising in open air, having good homemade food, avoiding junk, all these things can help your immune system. As far as tonsillitis is concerned, if smokers are specially advised not to smoke, because that in turn lowers your immunity and you are making yourself more prone to tonsillitis. Anna says, does home remedies help in tonsillitis? Well, to an extent, yes, it can be a supportive treatment, like having warm water or salt water gargle can help you in soothing your neck, soothing your pain symptoms. You can have turmeric milk, warm milk to just soothe or make your tract smoothen, or just pain relief can be done. You can have things which reduce the inflammation, like ginger is known to reduce inflammation, turmeric is known to reduce inflammation. These are certain home remedies, but I won't recommend going into the home remedies just for treating acute or chronic tonsillitis. It is just a supportive thing. Okay, how do I know my tonsils are infected? Well, if you open your mouth, Anna, and if you see your tonsils, they are swollen, enlarged in size, redness is there, pain, you can experience pain while swallowing. There are certain signs which are there. Ankita is giving a thumbs up. Yes, Ankita. Pooja says, how does homeopathy help in treating my tonsils? Okay, Pooja. So when we talk about homeopathic treatment for tonsillitis, firstly, homeopathy targets towards your immune system in general. It boosts your immunity, it improves your fighting mechanism, wherein your capability to fight off viruses, bacteria, all or allergic components, that is improved with homeopathy. Also, homeopathy helps in reducing the frequency of tonsillitis. If you are having say 6-7 episodes a year, that invariably comes down when you take homeopathic treatment for a good amount of time. Also, the intensity of every episode of tonsillitis, if it say require antibiotics every time, that dependency on antibiotics is reduced with homeopathy. The intensity, the severity of episodes, that reduces. And of course, in children, having those sweet pills are way more easier than giving antibiotics or heavy medicines to children. So homeopathy is any day preferred by children over allopathic medicines. In most of the cases of tonsillitis, homeopathy is successful in preventing surgery. I mean, we can help you out in preventing and surgeries, removing your tonsils, and thereby preventing further severe complications which can arise after removing your tonsil. Also, it improves your overall immune system. So something, if you're falling sick every time, that recurrence is taken care of with homeopathy. If your child along with this tendency is underweight or not eating well or has other general symptoms, that also improves with homeopathy. Your child starts putting on weight, your child's appetite improves with homeopathy. So it is any way better than conventional medicines when it comes to recurring frequent tonsillitis. There are very few cases in which homeopathy doesn't respond, or there are it is very difficult to reduce the frequency. Only then, in such cases, we ask the patients to opt for surgery. Otherwise, no. It is the last resort which we ask the patients to go to. Okay, I see white dots on my tonsils. What is it? So, Suraj, yes, white dots. If you see, find some white tiny things on the tonsils. If you notice that, it might be abscess formation on the tonsils. So that also requires treatment. So you can consult your physician if you are noticing that. Neha is asking, can gargles help in tonsillitis? Yes, Neha. Salt water gargles or warm water gargles can help you in soothing or reducing the signs of inflammation in tonsils. I got my tonsils removed 5 years ago. Why am I still suffering from colds? Well, that is the problem over here. If the tonsils are removed, that does not mean it is the solution, the complete solution, or you may never have episodes of cold or cough again. Your tendency to have cough cold still remains. So what you've done is you've just removed the guards from the border, but then there is still the tendency remains. So only thing over here to be done is to boost your immunity, take treatment which supports your immunity, that is will take care of the frequent colds. All right, too many questions. Nisha is asking, yeah, the same, I think, somewhat. Ishwari, thanks, Dr. Ishwari. Nikita is asking, I heard that removing tonsils is not good for health. Is it true? Well, yes, Nikita, that is what we are discussing right now. I think she's just joined. So, removing tonsils is obviously not good for you. You are just making the enemies, making more prone to your body by removing the guards from the border. So, yes, it is actually not good. There are certain complications happening when you remove tonsils, like the infection may go into the blood, causing complications of the heart. It is called rheumatic heart disease. At times the bacteria which are known to affect tonsils, they also are known to cause bronchitis. They're also known to affect your kidneys, giving rise to glomerulonephritis, which is called in medical terms. So yes, there are complications happening if they are removed, the tonsils are removed. What precautions can be taken to prevent tonsils infection? Well, tonsils, when they are infected or inflamed, that is tonsillitis, it is contagious. So you can spread this tonsillitis to other people, be it by coughing, sneezing, kissing, sharing spoons or glasses. So yes, it is contagious. So the main precaution is to be away when from people who have active tonsillitis, active acute tonsillitis. So by avoiding the infection, that is how you prevent it. Avoid going to spaces which are crowded, because the viruses and bacteria are more prone in crowded places. So avoid going out in crowded places. Cover your face, cover your nose when you are having acute episode of tonsillitis, and take timely medicines. Take medicines which can immediately address this acute infection. That is the precautions you can take. What is adenoids? Aparna is asking. Adenoids are again a part of the immune system, somewhat like tonsils. We call them as nasal tonsils. They are located at the base of the nose, so they are also your guards. They help you. They help you protect. They act as a defense mechanism to protect from the viruses and bacteria. So at times when adenoids are enlarged in size, they give rise to symptoms like snoring, or mouth breathing, or dryness of mouth. You may see children keeping their mouth open when they are sleeping. This could be because of adenoids. Again, adenoids can be treated very well with homeopathic treatment. We can give medicines which takes care of the infection, of the recurrence, and we can somewhat help in reducing the size of the adenoids, count about from up till 20%, wherein the breathing difficulty is eased with the medicines. Also, in adenoids, patients are suggested surgery. Again, if the size is very large, if this patient is having difficulty in breathing, only then surgeries are advised. Otherwise, it can get better. The size can be reduced. The recurrence can be improved with homeopathic treatment. Hello Fahad, Christy, do antibiotics make sore throat go away quicker? Well, this is doubtful, because antibiotics have a role to play only if it is the tonsillitis is caused because of some bacteria. Antibiotics have a role to play only in bacterial infection, but yes, the acute episode can be taken care of with acute medicines like antibiotics. Homeopathic medicines also act quicker when it comes to acute tonsillitis. So medicines like belladonna, like ferrum falls, these help in reducing the signs of inflammation. But if it is recurring complaint, if it is happening frequently, that requires a detailed case history homeopathically, wherein we can give medicines which suit you as a person and the recurrence is taken care of. Fine, then. So I think we have had a good conversation about tonsillitis and adenoids. Well, friends, the message over here is save your tonsils, save your kids from getting your tonsils removed. I know this is something exciting for the kids, wherein when they are suggested surgery, they are asked to have ice creams. So this is the most exciting part of the surgery of tonsils. But then we should be aware of what are the consequences of getting your tonsils removed. So, save your tonsils with homeopathy safely and very permanently. So, just you can log in into your our website askdrsha.com to learn more about scope of homeopathic treatment for tonsillitis. If you have any queries, you can get in touch with us at any of the doctors over here at LifeForce. We will be always be able to help you out. I hope this session was helpful. Bye bye. Take care of yourself.